The city of Milton Keynes is an experiment gone right. Built in the 1960s to provide relief for overcrowded London, the architects of this garden city recognised that telecommunication would change the life of people drastically, and that new models of living and working together needed to be found, and tried. New town or not, Milton Keynes does not escape the demographic change that is taking place all over Europe and in the rest of the world. But the people living here may just be slightly ahead of the curve when it comes to finding innovative ways to deal with this situation. Come with us to Green Milton Keynes and see how the city remains a model of how information and communication technology changes the lives of people in a way that is good for them. In the framework of the independent project, the Milton Keynes City Council, in collaboration with the carer organisation Carers MK and IT solution provider Adaptec, are now running an integrated service to better support informal caregivers and the people they care for. The service is built around an online portal called ConnectI that was specifically developed for this task. Informal carers and people in need of care can track, monitor and request support, or simply have video conversations with workers of Carers MK, friends, family and others to reduce their isolation. Furthermore, the portal helps Carers MK to streamline their own work, allowing support workers to manage client data as well as to organise events and other appointments. With the help of the portal, Carers MK can now organise its own services in a much more efficient way compared to before. To make the service available to everybody, the City Council provides refurbished PCs and other equipment from its own stocks at a very low price. In that way, the service can be made available to people that are not yet participating in the online world. In the offices of Carers MK, we meet Lisa Bailey of Milton Keynes Council, who gives us a detailed insight into how ConnectI supports the work of the organisation and the life of carers and older people.
So one of the important things about the information that we capture is that within the assisted person's records we hold the details about the condition or conditions that they suffer with, and a lot of work had gone into categorising those conditions based on how they deliver information. So for example, if you've got a carer who's looking after someone who has Alzheimer's, then obviously the information that we deliver both on the events and on the online information, they want that information to be about the condition they care for, not about a condition that's completely not relevant. The reason this is important is that when you do create the details on an assisted person's record, and I'm just going to go back to a record now, it is that contained within the record is that information, and that's how from here, that's how the login is tailored. So when a carer logs in, the information supplied will be based on the information that's input into that record. So they will also get information that's deemed necessary for all carers. So I'm just going to go to the online information. So for example, there will be useful web links here that relate to all carers that haven't been grouped, but there will be other links here and other useful documents that relate specifically to the conditions listed for that carer and AP. And also when we book events, they will only have events come up that are either listed for all carers or listed for specifically for groups relating to mental health or to brain injury. So I'm just going to have a look at the events at the moment. So of all of these events here, if a group is specified on that event, when the carer logs in, they will only see those that are specified. So just to show you also how that affects information we upload. When we upload a useful document into the back office part of the system, we can actually determine again what the target audience is for that document. So when they do go to that online information, they will see information specifically targeted to the conditions they have to support on a daily basis. These bits of information, either web links or videos or documents, aren't seen by the assisted person. They're only actually seen by the carer, and that's because carer's Milton Keynes role is just to look at, is just to support the carer. And also some of this information might be quite sensitive, so whilst a carer might want to know about the particular habits of that they might experience as a result of the person they're looking after suffering with a particular mental health condition, the person that they're looking after doesn't really need to read that information. So again, the information is completely isolated to just the carer and not the assisted person.